Hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. Blood contains many proteins called clotting factors that can help to stop the bleeding. Hemophilia is caused by a mutation or change in one of the genes that provides instructions for making the clotting factor proteins needed to form a blood clot. People with hemophilia have low levels of either clotting factor 8 or clotting factor 9. The severity of hemophilia that a person has is determined by the amount of factor in the blood. The lower the amount of factor, the more likely it is that bleeding will occur, which can lead to serious health problems. Today, on your favorite health TV talk show, The Physicians, we'll be talking about hemophilia, the causes, the symptoms, presentation, management, and of course, complications. Do stay tuned. It's another day on your favorite health TV talk show, The Physicians, where your health is our business and will always be our business. Today on the show, we are talking about hemophilia. Have you ever heard of such a name before? It's a medical condition, and of course, we are going to deep dive into it just around the corner. My name is Dr. Memuna Yusuf Kadri, and you all know on this show, I'm always with my co-host, the very beautiful and delectable.
My name is Dr. Martina Agberia. Welcome to The Physicians, where your health is our business and will always be our business.
Great, Dr. Martina. We're talking about hemophilia.
That word, hemophilia, each time I remember it.
It sounds like a very nice word, though. Hemophilia.
But for those that have it, it's not nice.
That's what I'm saying. It's just like a flower word, like hemophilia, like a beautiful word.
And a person who has it in the family didn't find it funny.
What is your worst case of hemophilia as a doctor so far, since practicing?
Since practicing, a guy who had hemophilia and was involved in a road traffic accident.
Ash. I'm just imagining the sight.
So it was horrible when they brought the patient to the accident emergency, and we got to know, because as God would have it, he actually moved with a card.
To show that, and that's one thing that a lot of people do not. Yes.
So that card, because without even giving history,
that card just showed that.
Well, maybe we knew that blood bank
treatment was different. No delay in anything.
There was no delay, and that was what saved the guy. Because everything was, every second matters in medicine. So remember the moment he arrived and they saw that card. Everybody. But
how do people detect that he had the card? Was it conscious?
No, it wasn't conscious, okay? They need to write names and everything. Yes. So they were removing things from his pocket.
Okay, that's what they now
saw, like ID card. They now saw, I have a hemophilia patient in case of emergency. Made that thing, so everybody call the blood bank, do this one, get
adrenaline drive, everything.
And it was beautiful. So you could see doctors in action. Everybody was also working in silence.
So you are not saying, what if he didn't say he had hemophilia?
It would have been really bad, because the problem of hemophilia, the clotting factors. Yeah. You can't clot, you will just be bleeding. To arrest the bleeder.
Everywhere be bloody.
Everywhere was really horrible.
I'm happy that number one, he was able to have that. Number two, you found it, and then you were able to treat her.
And guess what happened? A relative that came with the patient who didn't know was screaming that we've been holding this thing, the bleeding is not stopping, the blood is not stopping. So that was that sign. It's not stopping, we've tied, it's not stopping, so.
I'm happy that he was rescued and he healed at the end of the day. We'll be right back after this short break. Do stay tuned. Okay. So this is the one I'm using now.
But you really know that.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from EZEOMA. Darvite. Love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today on the show, we'll be talking about hemophilia. And The person we have with us in the studio is no other person than the amazing, beautiful, walking encyclopedia. No other person than Dr. EZEOMA, EZEOMA. If you don't know anything, EZEOMA, the OMAs here. She's a consultant pediatrician with Lagos University Teaching Hospital. Hello, beautiful.
Thank you.
You're welcome on board.
Yeah.
You're looking really good.
Oh, thank you very much.
She's working on her name, EZEOMA.
IFEOMA.
IFEOMA.
Yes.
IFEOMA means what?
Good thing.
Good thing.
In Igbo.
IFEOMA.
And good king.
And
good king. Eze is king in Igbo.
So you are walking the talk, my dear.
Thank you very
much.
much.
So we're talking about hemophilia. What is hemophilia and what causes it?
Okay. Hemophilia is an inherited blood disorder where the people that are affected usually have problem with clotting, blood clots. So they have bleeding, abnormal bleeding, prolonged bleeding, and bleeding into different parts of the body. And what causes this is because of deficiency of what we call factor 8 and factor 9. These are proteins in the blood that are important to make the blood to clot. So they have usually abnormal bleeding, and just as we said, it's an inherited disorder. That means that people that are affected are born with that. They are usually born with it. So you see it at birth. Depending on the severity, you have the mild to moderate to severe one. Then also, you know, male and female, we have two sex chromosomes.
Yes.
The male has the XY chromosome and the female has the XX chromosome. The funny thing is that most of the time it's the female, the mothers that give it to the children, because the X chromosome will come from the mother, while the Y chromosome will come from the father in the for a male child. But for female children, both X will come from the mother and the father. So women are usually the carriers of this very bad gene that they transfer to the boys. However, not everybody that carries the gene give it to the child. It's a chance thing. So it's like 50% of cases that you see that they can, you know, they have 50% chance of transferring hemophilia to the boys. So boys are mainly affected. Female can be affected, but rarely. And when you see a lady or a female being affected, that means that there might be they have two X chromosomes. That's why I'm going into details with the genetics. They have two X chromosomes. So one of the X chromosomes of the female maybe is inactive, and the good one is the one that is inactive, and the one that overtakes it is now the one that is defective. So usually there is a genetic mutation that causes this to happen, because it's this gene that gives information about how the clotting factors are being produced, this factor 8 and factor 9. Yes.
Okay. It's very, very interesting. So if a female is likely to have it, but it is rare.
It's rare.
Probably because
so you find it in a case we call lionization. So meaning that they are inactive, or more, maybe one of the X chromosome is deleted, like you see in Turner syndrome. Remember Turner syndrome? So these are the cases, rare cases that you see it.
So are there various types of hemophilia?
Yes, we have two types. You have the classic hemophilia, which is due to deficiency of factor 8, and we have the Christmas disease, which is type 2, and that's type
Christmas disease.
Yes.
Why is it called Christmas disease?
Yeah, it's called Christmas because of the first person that he was first seen in the hemophilia B. He was found in a 5-year-old child. That the name is Christmas, the surname is Christmas, Stephen Christmas. So that is how it came about. So it's just because of the first person that he was found, first diagnosed. The way you also named tornadoes. Yeah, so they named it after the first person that they found it. Also, it can also be called royal disease because they have been known to be seen in royal families, like in English royal families, and also some of the Greek and some other places. So, but the most common name that we know it as classic type A and type B, due to factor 8 and also due to factor 9. And the 9 one is also called Christmas disease. So it's a common name.
Do you want to expatiate more on the types? What differentiates one from the other? Well,
it's just different. It's just because of the factor that is deficient in, but it's factor, the classic type, which is hemophilia A, is more commoner than type B. So they're still the same thing, but it's just that it's more common, and because of the clotting factor that is being deficient, that is what makes the difference. Yes.
Sounding so like
it's
really when we make that chromosome,
factor 8 and 9 have a problem.
Yeah,
What is the role of factor 8 and factor 9?
They are involved in clotting. You know, the coagulation system. You know, when you have a clot in the body, you know, you have the primary hemostasis and secondary hemostasis. Exactly. So the primary hemostasis is the one that once there is a clot, platelets will come, form a plug and all that, and we now go to the coagulation system that will cause a secondary hemostasis. So it's in that part that they're involved. So they're very important in making sure that the blood, so arrest bleeding, that the blood stops bleeding. You know, forming the fibrin. That's the final pathway for fibrin formation.
So that's the reason why I asked that, because people will like we've talked about factor 8, factor 9, people wondering, okay, what is this thing all about? And now you've explained it, it makes it easier.
Easier, very important.
Very important.
Very, very important.
How do people with hemophilia present?
Yes, you know, I said initially it has severity, it can be mild, moderate, severe. Actually, the mild type, 25% of those affected have the mild type of the disease. You have the moderate, like 15% of those affected have the moderate type, and you have the severe. In fact, more than 50% of cases usually have severe. That means they have very serious bleeding problem. So you can imagine. So they can have different presentation. Maybe from mild type might be just we see recurring nosebleed, easy visibility. Maybe sometimes they can have bleeding in the urine or in the stool. Then also they also have the severe forms, might be bleeding. They might just have spontaneous bleeding. You just see them having spontaneous bleeding into the joint.
Not that there's any cord, nothing,
just bleeding,
no
just
injury.
Yes. You know, so you can bleed into the different parts of the joint of the body. Mostly the elbow, the knee, and the ankle joints are the ones that are mostly affected. They can bleed into the soft tissue, the muscles. You know, they can also, for newborn children, you know, sometimes when you have a child and you have a baby that has been born and you see them having cephal hematoma, you know, it's not something you can just close your eyes to. You have to really try to inquire to find out what is the cause. So you have different barrage of presentation. You know, there are also dental extraction, following dental extraction. You see people that have prolonged bleeding. These are the ones for the moderate type. When you see a child that have prolonged bleeding following dental extraction or minor surgery or following surgeries, is something you should raise an eyebrow. So these are the different presentations. So mostly they have prolonged bleeding from different parts of the body. They can even bleed. I thought about bleeding into the brain. So the children might even have recurring seizures and different neurological problems and chronic joint pains and arthritis, and also it's a very life-threatening situation, especially for those that have severe type. So it's not something you should play about, and also that is why the awareness is really important. So people be aware. You know, in our setting, African setting, every small thing we are saying that it is due to one thing or the other. But exactly. So if they are aware of all these things, they should know where to go. Just like the story you said. If the patient you talked about wasn't aware of what's they will have lost the person will have died. Will have died. So awareness is important, so that whenever you're going, anywhere you're going, you have to sensitize. We have a place of, you know, making people know that you have this, so that whenever there is emergency, you know what to do.
For parents, at birth, at what age? It's usually known that this child has hemophilia. And what is the role of the family? For instance, the mother who is aware that this child has hemophilia. You have been seeing patients as a pediatrician. How have you been able to manage them?
So there are a lot of factors that come into play. When you have a family history, once you have a family history, maybe that's why history taking in medicine is very important. Because when you come, and even from the antenatal period, you ask any family history of prolonged bleeding, you know. So once you have a history like that, you have to raise an eyebrow and get ready. So just like what I said, when a child is being delivered and you're seeing the child having bleeding to the scalp or having cephal hematoma, and this is another presentation, so you have to raise an eyebrow. Then circumcision is another type in the in the neonatal period that once you see prolonged bleeding following circumcision, these are the things that raise an eyebrow. But most importantly, once you hear the history or have a history of such, early neonatal screening, newborn screening is important. So you screen on time so we can start management on time.
Early neonatal screening?
Yes.
Screening on time so that you know that if this baby has hemophilia or not.
Yeah.
That is so apt because you may not even know until later in life
that there's a very severe bleeding that you won't even be at a center that will have the things
exactly,
to manage,
and it may be too late.
It will be too late.
Please tell us, is there any classical case of hemophilia you've experienced in this number of years of practice?
Yeah, we've had some cases, like I remember a family, 2 of the children, male children were affected. So actually we didn't even know. So it just came that he was playing and hit the leg, and by the time they came, the joints were swollen. And you know, and when you have that kind of history, male child, just minor injury that people usually fall, children usually fall a lot of time. So it like raises a high index of suspicion. So immediately the child was just bleeding, the joints were already swollen. So immediately we start screening and we found out that there is this deficiency of factor 8, and you know, we'll just start the management, and that was it. The another case we had was a young girl, adolescent age, started have, you know, when menstruation, usually have prolonged heavy menstruation, heavy blood flow. We're like, this is not like, I know some people have normal heavy blood.
And it's not that she had fibroid.
No, but had just a young girl. So that's another way that we were able to nip it, that this is what it is. So when you have some cases like that, it's something to raise a high index of suspicion. So
I'm glad you just said this. Again, I was seeing her period and prolonged. It is not every period that is prolonged that has to do with hemophilia.
Heavy.
We're just trying to clear that angle. So now you have said all these ones. I'm sure everybody will ask you. So how, apart from the bleeding internally or even not stopping when the injury starts or the bleeding starts, how exactly is the diagnosis made?
Well, it's still the same, taking the blood sample and doing hematological investigations, check for the level of clotting factors, do clotting factors screening, and find out if there are deficiency of all this. So it's mainly a hematological one. But then, if like you have a child that said, if you have, you know, thinking of an intracranial hemorrhage or bleed, we can also do some radiological investigation. But most importantly, is checking the level of the clotting factors, and you know, do a clotting profile.
Okay. So that is the diagnosis, right?
Yeah.
Because under normal circumstances, when you have an injury, what we're supposed to do is just to apply little pressure.
Just once you do a pressure,
just apply little
the normal
pressure.
Hemostatic this thing in the body will help and stop arrest the bleeding.
So at home, because at home when you have an injury, apply pressure, it goes. For a patient who has hemophilia, deficiency in factor 8 and 9, it's of course going to be very difficult.
It's going to be very difficult.
Is it that is it only going to be prolonged for a while and it will stop, or you must get to a hospital before it stops? When you apply serious pressure, will it stop? It will just take a longer time.
Yeah, this is a very important question. That's where the types, the different, can be mild, moderate to severe. If it's a mild thing, and depending on the level of the factor 8 activity. So also, even checking the amount of factor 8 in the blood, you also check the activity. So some people will have like maybe it's just a mild deficient, maybe little, so they still have factor 8, so it might still stop. But then you still have to really go and be checking. Yes.
So how do you treat hemophilia?
Treatment is just very simple. But not simple in a, once you know what it is, you have the preventive treatment and the main treatment.
Exactly.
So it's still in the same way. Preventive treatment is that you already know that this child has hemophilia. So they usually routinely give them factor 8 infusion. So there's you meet your physicians, you have a way schedule that you come in, you can even be taking it yourself, you know, just like insulin deficiency, you know, you just be replacing those, it's just like a continuous replacement. Then of course, when the child now comes down with the bleeding, you now have to still give factor 8, and also we have a hormone that helps stimulate the production of factor 8, we call desmopressin. So these are the treatment. Then other symptomatic management, you know, if the child has bled so much, anemia and everything, you can give other blood products. So treatment is also individualized depending on what the child has.
Okay, so because we know in terms of management, right, the aim is to complete cure, right?
Yes.
And for this kind of situation where you have the deficiencies total
you don't have
absence,
to, so you must have to be replacing that factor 8.
So it means you must replace the factor 8 and 9 possible. Yes. So it's obviously for life.
Yes, for
so
life.
Is it possible that like for prophylaxis, they take the factor 8 after a year or 2 years, they come back and take factor 8? Is it done that way? Or
that's where I'm talking about the preventive method. The preventive
so they just
management.
keep taking it.
You just take it intermittently. Yes, not that you already have the bleeding. You are just replacing it, so to prevent any form of life-threatening bleeding.
That is really
yeah.
So it's really a life-threatening.
It's a life-threatening.
And I can assure
people can die. Lost a lot of people.
So what's life expectancy for people with hemophilia?
Life expectancy depends on the individual, if it's mild, moderate, severe.
Okay.
It depends on how it's being managed.
Okay.
So everything depends on the management. It depends on how prompt the management is and how quick it is. So I won't say that this is a particular life expectancy. And we have a lot of us. In Nigeria, one of our professors did a study, Professor Temi, and said that up to 1 million Nigerians are living with hemophilia. So you can imagine how bad it is. So we encourage people to have, we have a lot of support group. That is why, thank God you brought this to the fore, and we are still going to celebrate our World Hemophilia Day, which is coming very soon. So they have support group even in Nigeria. So the support group helps you to source out for all this factor 8. Once they come, we have support from other developed countries. They give us factor 8. So from that support, we have other families that have children or patients living with hemophilia. So you'll be able to get support. You discuss challenges, you know how you manage. You know, when you have somebody having the same thing that you have, you give you empathy, and people can share, you share ideas, you work together. It's like a family.
You know you're not alone.
So you know you're not alone. So they can give you things, how their survival strategy, how they're able to be survived. So it's really very important. So that support group is very important, and we have it. If you go online, you can get it online.
I'm sure they'll be wondering, asking, this factor 8, is it in pharmacy? Are we able to buy it at the pharmacy? Or we have to go to the hospital first before we can
I don't really, most of the time there's a way they arrange it. It's being sent to tertiary centers. So that is how the group
is understandable,
because it's not something you can just go and get from the pharmacy.
Unless
it's a very big pharmacy. We have very big pharmacy in Nigeria.
It's not an over-the-counter method.
It can never be an over-the-counter. The kind
of
of thing that is done, the work of that factor 8, is not what an individual can just buy and use.
And it's really very expensive. So there's a way it's being sent, a subsidized way. And so that's where the support group goes. Once you come, you have a factor 8 centers in different places. So you can just call.
So good to know.
And I like the fact that we are talking about this because it's also good for us to bring to the fore, how does hemophilia affect life and daily activities? Because it's such a bad disorder. So how does it affect?
It's so depressing. Psychologically, there are lots of, even it's so traumatizing, even to the family, to the child. You know, the child might be out of school. So you know, so there are a lot of psychological problems. So also in the management, not just only hematologists are involved, psychiatrists are involved, physiotherapists are involved, even orthopedic surgeons, because it involves the joint. So it's a multidisciplinary approach. There are a lot of people that are involved in the management.
But for my here, we'll keep. I don't know whether I'm feeling a bit sad now. I don't know because the name is so nice.
It's so traumatizing,
but it's so traumatizing.
Actually, the name hemo is blood. Philia is love. Like it's a good.
Do you understand?
So it's not as if that it looks nice, but
it's not a good thing. Like with what you have been explaining, is so.
And the truth is that we really do not appreciate what we have. That you have an injury, you have a cut, and it just stops. So nobody even understands that thing. There's a process. Now we are not telling people that we actually have factors.
We have a lot of clotting factors, but these are the main
ones that when it comes to hemophilia.
Yes.
Once again, thank you so much, Dr. EZEOMA. And to our viewers, you can feel that my voice is not so as the beginning, right? Because this is such a bad medical condition. If you have a cut and it stops bleeding on its own, or maybe you just apply little pressure and it stops, you do not know what God has done for you. Because there are some people, no matter what, it doesn't stop bleeding until they get to the hospital and get treatment. And you've heard it, it's not a disease that has a cure. It can only be managed. On this note, my name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Dr. EZEOMA, I really appreciate your coming and enlightening us on this particular topic on hemophilia. The truth is, this is actually the first time we're handling this topic on our program, and it's very, very enlightening. What came to mind was, I'm just imagining the number of male children, babies that died from circumcision, from traditional birth attendance.
Yes, in the village.
In the village.
Yes.
You know, people just give birth to
really
churches and they do circumcision.
Especially at the primary health care, level, we have a lot of, as physicians, we have a lot of work to do. A lot of things we need to demystify.
There's probably a woman now with stigma that they just from circumcision, the baby died, you are responsible. Ignorant, really. So really, I really appreciate you, and you can be rest assured I will call you again.
Thank you
come
very
and
much.
enlighten us more.
Always happy to be here. Thank you very much.
And to everyone out there, we just want to say thank you, and we appreciate you always being with us, keeping a date with us on our program, The Physicians. Hemophilia is real. Don't take for granted what you have. When you have an injury, it starts to bleed, it just goes easily, it stops. But when you have hemophilia, it can take hours. So please try and go to the hospital if you have any of such challenge. I'm sure as I'm speaking, you are beginning to remember one or two persons that, oh, probably this was what happened to the person at that time. Hemophilia is real. Male children, they're very observant, and parents, be more careful. I just want to say thank you again for keeping the date with us. Remember to follow us on our social media platforms if you want to be part of this program, like Dr. EZEOMA, IFEOMA. You can go to our website and send us an email, and of course, you'll be here. The next time, stay blessed. My name is Dr. Martina Agberia.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.